base. We are 10-8-16 to 22nd MP for Thursday's location.
Come on a tour of our health bus. Over here we have Deb. She's a paramedic. She's one of the team members here. My name is Sheila Achilles. I'm the Director of Primary Health in the Saskatoon Health Region. She's actually the one that drives this thing from where it sleeps overnight to where it comes during the day. The Mobile Primary Health Center isn't really a bus. It's a retrofitted RV that come in so that we were able to access and change it and remodel it into a health center. This is Kate, she's our nurse practitioner, and this is where she triages and talks to the clients that come in and finds out what the problem is and what it is that the reason that they're here for. So when we go inside, you don't actually see an RV, you see a mini health center where staff work. We're working in the core neighborhood right now, and there are people that primarily live at risk, and I mean socially at risk. There's a lot of poverty, there's a lot of drug addiction, there's broken families, abuse. And so as we hear the sirens go by, this is a normal day in the core neighborhood of Saskatoon.
Hello.
How are you?
Some of the problems that we were up against when we first envisioned the health bus was primarily funding. We needed to get funding to get the bus going. But the other challenge was to gain the trust of the community. And the only way of doing that is to be on site.
I have used the bus on Appleby Road in Meadow Green.
90% of the people that come to the bus do not have a family physician.
22nd Street.
Being here day after day after day.
I've also used the bus here.
32 on 76, that's pretty good.
Right on.
I think before the bus was here, these people were primarily either not attending to their health or waiting too long to attend to their health.
Exactly 220.
And any heart troubles?
This bus is a public-private partnership, which in Saskatchewan, old NDP country, is a little bit of a dirty word, but I'll tell you that it's one of the best partnerships that I've ever been involved in.
How long has he had the fever for?
Probably since this morning.
Since this MD Ambulance, which is a private EMS service company in Saskatoon, partnered with the health region, and what they have done, and when I was working on developing the health bus with them, I said to my boss, my hardest job is to run fast enough to keep up to them. The health region is like an elephant. It doesn't turn quickly on a dime. And the private companies, they can recruit, they can get money, they can get things done way faster than the health region. But the health region will bring other skills to that. So this private-public partnership has been extremely interesting to me, and it has actually, I think, set the stage for further partnerships that will help the community. When we were able to get the bus, it was donated to this project by the CEO, president of MD Ambulance, but it's old and it does break down. It continues to be a challenge for us, but we fix it all the time.
Mondays we go to Appleby Drive, which is a high immigrant population. We tend to be fairly busy there. Tuesdays we go to 22nd and Avenue W, which is the McDonald's parking lot there. Wednesdays we're at 20th and M.
Thursdays, actually, we park right at the corner here in this 7-Eleven parking lot. It turned out to be an excellent site, as in very busy, lots of activity on this corner. On Friday, we are down the street here on 22nd Street and Avenue G in the Giant Tiger parking lot. We're trying to help the people that walk by.
Saturdays we're at 19th and C, which is right across from the Salvation Army.
We're trying to help the young families. We're trying to help the young people who have addiction problems, or the streetwalkers, and we have many streetwalkers in this community who have very few safe places to go to. We're trying to help the people who are afraid to go to a medical clinic. They are afraid of the formal healthcare system.
These are the streets that we're usually out on, 20th Street and 22nd.
Poverty is the biggest health determinant in what goes on with the folks that live here. Life is difficult. Many of them do not have a job. Many of them do not have stable family environments. We have young children coming here, 6, 7, 8 years old, who haven't seen their parents for a couple of days, need to eat and have breakfast and lunch and supper. It's very hard for many of the people that live in this community.
Have a seat. What can we do for you today?
I was just wondering, what's the percentage of someone that was born with epilepsy that could grow out of it.
Could grow out of having epilepsy? When were
Yeah.
you diagnosed having epilepsy?
Actually, I was born with it.
We're very treatment oriented here. We don't do just public health, we don't do just education. We can do a broad variety of healthcare intervention because of the nurse practitioner paramedic combination. Nurse practitioners are nurses that work in an expanded role. They can diagnose, they can treat, and they can prescribe medications, which regular registered nurses cannot do. It's just been a fabulous combination between the two competencies of these professionals. Hello. Over the last 2 years, we've seen over 8,000 people at the bus. So there is a need for this health bus, and there's a need for all other health care as well. But the bus is just a great alternative care. It's hard to predict the future, but what I would love to see is a whole fleet of health buses.
10 days to heal up. It's not too bad.
Not too bad.
Not too bad.
I mean, that's not too bad.
I would like to see more buses in this community, but I'd also like to see more health buses across Saskatoon and throughout our Saskatoon Health region.
So it's closed itself. You are going to have a little bit of a scar there.
I'm used to scars.
There's a great need for bringing healthcare to the people, not expecting people to come to healthcare.
Jessica watches this, I love you, girl.
The nice thing about the polysporin is it's also going to stop the bandage from really sticking.
Jessica Danielle Williams, I love her lots. Where do you show this video at the conference?
Yeah, it's gonna be at the conference.
Could you give me an address or something? I'll try to get it right there.
Montreal.
That's all right.
Come on.
I can pay my sister for gas to get
Come
there.
on.
I want to try and get there, honestly.
Come on.
Yeah.
There you go. Oh.
You can give me an address though, just in case. Though, right? Or no?
Well,
It's not till November.